Dr. Matt Wallis from the Regenerative Center. And Matt, we normally talk about chronic pain, but today we're going to talk about hormones and how they can affect just our overall well-being.
Yeah. Okay. So, yeah, especially with weight loss, we kind of do both, and you know, they go hand in hand. And a lot of people, you know, you see the semaglutides and the fat shots these days that people are using, very successful in most cases. But what happens is, the question is, why are we putting on the weight? Because so many people, when they lose the weight, it goes right back up, and they're really frustrated. Women just feel so bad about themselves and don't want to try any harder. But what happens in our 30s, especially 40s, our testosterone begins to drop, okay, naturally. But with some of our foods and the plastics we have that in our diets, that also causes more and more upload of estrogen, and that's just going to shove us further down into insulin resistance. So if we fix the hormone, most cases, these weights not coming back again. So it's ultimately a hormone problem.
Gotcha. And so how do you all attack that problem? What do we do? Do we do some blood work and you look at that kind of thing?
Yeah, we do blood work first. But you know, what we want to find is at a baseline, if the hormones are off, what we realize is that hormones do just so many things. They help us to function and feel good. So in our youthful age, we want to feel good, we want to thrive and just, you know, get up out of the bed and ready to go and have energy all day long. But as they start to tank, our bodies just are not feeling good. But in the older ages, these hormones are also very protective. They protect our brain from dementia and things like that. They protect our heart from heart disease. So we see a host of problems are going to develop as our hormones start to get depleted in our bodies.
And we talked about this earlier, and I probably attribute it to, you know, as I'm getting older, I need to up my calcium, you know, for brittle bones or being, you know, being able to move. But you said actually testosterone can be, you know, low T can have an effect for women.
Huge effect.
In that.
Yeah. As we were youthful, we hear drink milk and add calcium, and everybody's on calcium. But the problem is that the outer coating of bone really is estrogen. And so men and women both have some estrogen in the body. So if we are not making estrogen, well, buddy, our calcium has nothing to bind to. So estrogen is very important in bone metabolism. Testosterone helps the osteoblasts to build up in the bone. So our patients come in with arthritis. They've been treating with orthopedics or chiropractic or physical therapy. A lot of these facilities don't look at a hormone level. But the truth is, some of the disease they have in the joints is due to they're just hormonally insufficient. And so no matter what treatment you do, they still have this hormone problem and they're not getting better. So we have to look at all of it.
Well, and I'll be honest, I really, you know, and I think a huge misconception is that the low T problem is more of a guy problem than it is a girl problem.
Yep.
But now we really need to pay attention to that as women to have those levels checked.
Yes, 100%. So that is often the problem, is that we think of testosterone as a male issue, estrogen a woman. Well, guess what? Men actually have a little estrogen and women have a little testosterone. Now, in the woman, testosterone is just as powerful, even though they have a little bit, as it is for a male. But it's so important for the protection and the function. Estrogen has 400 known things in the body, 400. And so it helps to line the arteries so nothing can stick to it. So many things. So it's very important to have your hormones checked, especially as the older you get. I feel that's even more important.
Gotcha. Now, do we need a referral?
Don't need a referral. Just come and tell us that you want to have your hormone levels checked, and how is that affecting my life?
Perfect. All right. Well, thank you for joining me. Great information as always. Good. Segment of Family Health Experts. Log on to WPSDlocal6.com/Family Health Experts. Up next, Dr. Tony Miliano will be here with me, and we're going to talk about hearing loss. That's up after this break on WPSD Local 6 Midday.